Sam Stribling, Hartford Healthcare, and I am a Riskonnect application specialist. Hartford Healthcare, as the name implies, we're in the healthcare space, and we are a multidisciplinary hospital network that has a bunch of practices, primary care and specialty, across the state of Connecticut. And so we're using Riskonnect to help us manage our patient safety and quality, as well as the financial side with the claims and other elements around risk. Prior to Riskonnect, we really had a multitude of systems that were kind of working together to try and attempt to be what Riskonnect is for us today. And what we were struggling with was really a difference in a system that's a data repository versus a true work platform, and being able to get our employees engaged, willing to report the incidents that are happening in real time, as well as get meaningful reports and dashboards out of it. So prior to Riskonnect, again, we were working off of spreadsheets, individual computers, different individuals, and we really didn't have a way to tie the information, again, back to the organization as a whole, especially being able to compare unit over unit or hospital over hospital. So really that's what we're using Riskonnect to help us do. So first and foremost, what Riskonnect was able to solve for us was really being the one-stop shop for our risks needs, and being, again, able to kind of go from those disparate systems into a single source, which really standardized and streamlined our processes, which was extremely helpful. So currently, Hartford is using a multitude of Riskonnect products, specifically focused around patient safety and quality, which is our patient safety events, our patient feedback, employee events, and then off of those, we have the reviews of each of those. So we'll practice our patient event reviews, patient feedback reviews, et cetera. And depending upon the need and the harm that we have evaluated in those reviews, we also use the root cause analysis module and peer review to help us really, again, hone in on that patient safety and quality. Additionally, we have our events tied to the claims. So what we're able to actually do is answer the questions of, we had X many falls last year, and this year that cost us X dollars and incurred, or what we paid out from the claims or risk side, and really marry kind of the frequency and severity of the events together. My favorite feature or capability is probably the configurability of Riskonnect, in the sense that you can customize it to your needs, but you don't have to reinvent the wheel each time. So for example, what we use a good bit of is the checklist functionality on the page layouts, process bars as well, to kind of help folks maintain where they stand, as well as really the automations and letting people know and sending them the direct links into the system, so that they don't have to manage or log in every day. They can be alerted proactively as to what's happening at their event or at their sites. Some of the results that we've been able to get are really streamlining processes, for example. And so we've used the Conga solution in Riskonnect quite a bit, actually. And we had essentially users going to look at our individual practitioners and trying to determine their claims histories and loss runs and things of that nature. And we've been able to really cut out about a month of time for some of our full-time employees that are used to be tracking down all this information. So it's pretty significant savings from a cost perspective and a time perspective for us, as well as the reports and dashboards. We've really been able to quantify, again, across the board, and be able to have our leaders looking at the same dashboard with their facilities broken out out of each, so that they can all work together on the same events, types, causes, reasons, etc., but in a standardized format that's very easy for them to understand and digest. We have become a bit of a victim of our own success, and we are continually growing and adding different modules. So our roadmap is looking like we're going to be expanding our employee event and workers' comp claims sections, as well as we've been working on diversity, equity, and inclusion initiatives that we are bringing live and across the system. And we are looking to bring in our property values, among other things, into our hierarchy structure that we've redone. So really looking to grow, and we've got a good bit coming down the pike. I would say the keys to successful implementation is really getting to a minimum viable product, keeping it simple at first. You want to work hard internally as well as with Riskonnect, the vendor, on what good looks like and what that end result is, and keep that in mind throughout the whole process. So if you're looking to get a specific report out at the end of a process, make sure you have that report and those goals clearly stated, as well as make sure you have internal engagement around the system as well. You're really only going to be as good as the user engagement that you get and the adoption of that. So I would say do the homework on your side as well as engage the vendor to help execute those actions, but a lot of the work does need to take place on the client side. I mean, working with Riskonnect's been, it's a lot of fun actually. You know, it's a laid back group of people able to connect easily and in a really informal way, able to reach out as needed and get on that call, whether it be kind of a fire alarm drill that everybody goes through, whether you like it or not, or just kind of your standard check-ins and things like that once things are running smoothly. So been really nice to work with them. The advice I'd give others, again, is just to make sure that you're doing a lot of that work up front and that you have a clear definition of what you're looking to accomplish and setting off enough time to make sure that you can accomplish those goals. And again, don't try and boil the ocean up front. Plan on coming back and enhancing it. So again, we kind of follow a minimum viable product aspect, get the simplest solutions out as quickly as we can, and plan to enhance. And so when we bring something live, we'll have a meeting set up with those core team users, typically a month or a quarter out, so that they know they've got a forum in the future to enhance it to meet the specific needs that they have. So don't let good be the enemy of great, or great be the enemy of good. Really, I think make sure, again, you have a good interface and a great relationship with your team. Be talking to them, reading the product release notes and different things like that to see what's coming out, having a good conversation and open dialogue with them too about new features and functionality that might fit your situation. Oftentimes you don't know what you don't know, so make sure you have a little bit of time to ask those questions. But that's what I would say is things are kind of ever moving and changing, and so stay on top of all the new things that are coming out.